I'm Dr. Trinity Curry, and I get common and unique cases all the time. I'm a family practitioner at Robbins Landing in Jacksonville, Florida, with an outstanding team alongside of me. We are always ready for whatever comes at us, but sometimes you just don't know which way to go. So you always have to be ready to do multiple tests and run multiple scans. As I said, we are located in Jacksonville, Florida, and I've been living there for over 8 years. But on a particular Friday, December 8th, we were presented with a pretty common case, so let's go through it. These are the Gills, but most importantly, Sean and Alicia Gill. They both came into my office. Alicia came along just so she knew that he would not leave out any important details when we were going over his informational chart. So when patients come into my office, I tell them to fill out an informational sheet so we can learn more about them and the problem at hand. According to Alicia, Daddy Duty stresses Mr. Gill out. He is stressed. He has to take the son to basketball practice. He has to drop him off at school. He has to take the daughter to ballet. He has to take her to school also. All of this stress builds in Mr. Gill, and it causes him to drink. He drinks not one and not two, but 3 whole beers a day. 3. The crazy thing is, he had a chance to slightly prevent getting this issue because his wife always cooks healthy foods, but he chooses not to eat them. His favorite foods are fried foods, such as gizzards, chicken legs, all that good stuff. So before I actually enter the room to talk to the patient, my coworker, Lisa Holmes, goes in to check his vitals, including blood pressure, temperature, weight, height, and heart rate. So his heart rate was 78, his weight 165, his temperature 98.6, and his blood pressure was 130/88. A little bit high, but not too high. I entered the room and I introduced myself.
Hi, I'm Dr. Curry. How are you? And so I see that you're having some issues with your foot. So just tell me what's going on.
Well, I've been feeling a lot of pain in my right foot for the past 2 days. I woke up Thursday morning with a constant pain in my right foot, and I thought if I rested, it would get better. So I took the whole day off work to rest, and that did not help. So that's why I'm here this morning. Can you help me, Doc?
Of course I can. Just let me take a look at your foot real quick.
He's taking off his shoe, and I'm like, oh my gosh, I hope this is not disgusting. But this is what I saw. Not too bad. I mean, it could have been worse looking just like this. So yeah. So I look at it and I immediately think gout. It has to be gout. Just looking at it, it has to be gout. So this man's like, gout? Girl, what is gout? So basically, I said this.
Gout is an arthritic disease of your joints caused by too much uric acid in your body. Normally, your liver processes various substances in your body, including purines, which are components of genetic material found both inside your cells and in some foods you eat. When your liver breaks down purines, a waste product called uric acid is produced. Your body disposes of this waste through your kidneys, which remove it from your blood. When your liver produces too much uric acid, or your kidneys do not remove enough of it from your body, excess uric acid accumulates in your blood, resulting in a condition called hyperuricemia. Caffeinated beverages affect the waste removal function of your kidneys by increasing your urine output, which eliminates too much water from your body, a condition called dehydration. Dehydration can result in a higher concentration of uric acid in your body's fluids. When the concentration of uric acid becomes too high from any of these sources, it can no longer stay dissolved. The excess uric acid begins to form needle-like crystals inside your joints, most commonly in your big toe. Formation of uric acid crystals leads to an inflammatory response. White blood cells from your immune system attack the uric acid crystals, resulting in joint pain.
After all that, this man was still looking at me like I just spoke a whole new language, so I had to break it down for him.
What is the gout? Well, gout, or the gout, as some people like to call it, is a form of arthritis, which causes severe swelling, usually in the ankle or the big toe. It's caused by a poor diet, including things like...
So, to give him a better understanding as to why he has this problem, I did recall him saying that his grandfather had had gout before. So usually if your family has it, he was most likely, that's probably one of the reasons. And two, his diet was awful. So the first thing we did was we took a blood test. Usually blood tests can show the presence of uric acid, and that can signify whether or not it can signify gout, but it can also signify other things. So I did not solely rely on the blood test. So I went back to Mr. Gill and told him the results of the blood test, and I did see that he had a high amount of uric acid in his blood, but I did not want to jump to conclusions. So what I wanted to do was take a sample of fluid from the affected area to get a closer look. So I basically took a sample of the infected area, and then I sent it to the lab to be tested to see the presence of the uric crystals, because under the microscope and you can see the actual presence of them. So once I did look under the microscope, I did actually see a lot of uric crystals. So that's what really told me this is gout. It has to be gout. I went back to tell him the results, and guess what this man did? I said, I know this man did not have a temper tantrum over gout. It's non-fatal. So I went back and we talked about the treatments and procedures of what to do next. So I gave him the option of an anti-inflammatory called Celebrex that will work fast to reduce the pain, or I gave him the option to inject prednisone into the joint to reduce the effects. But both medications come with side effects that include high blood pressure, mood changes, stomach pain, as well as bleeding. So his wife just busted in the conversation talking about something. Oh, he'll take the Celebrex. And I was like, oh, okay. Even though I prescribed him medication, he still needs to make lifestyle changes. He cannot keep up with the same bad diet. He has to change the way he eats. And he also has to stop. I also gave him suggestions because drinking is not the way to reduce stress positively. So I told him to try different sports that include golf, boxing, basketball, anything other than drinking. And I know kids are stressful, but drinking is just it's just not it. So then I told him to also visit the local nutritionist so that she can give him ways to help incorporate healthy foods into his diet.
Before they left the office, I told him to come back in 3 weeks and make sure that the medicine's working. If anything happens before then, to give me a call and let me know, or to come in the office. So 3 weeks later, I got an email from Mr. Gill saying that his gout was doing perfectly fine. His swelling went down, and everything's doing fine. He doesn't feel the pain anymore, and the medications really worked. So I was very excited to hear that he's feeling better, he's back at work, and there's nothing holding him back, and he has changed his healthy.